Hey guys, this is Lawrence from Oasis Physiotherapy, and today we're going to talk about anterior shoulder impingement. So this is the most common shoulder issue that I see in the practice. It's usually a lifestyle-based issue, so it comes on out of nowhere. There's no kind of mechanism of injury, and it does affect up to 70% of people. Okay, so let's talk about what anterior shoulder impingement is. So let's go through the anatomy. This is your shoulder joint. Okay, so this is the collarbone. This is the shoulder blade in the back. And this is the humerus right here, the arm bone. So what can happen is, for a normal person, that humerus sits nice and center to this joint right here, the glenohumeral fossa. And what can happen over time with lifestyle and with the way you train, this can start to glide forward in the joint, okay? And when that does start to glide forward, this can cause pinching of all the structures there, such as bursas, muscle tendons, the rotator cuff, all that good stuff. And that can cause some irritation or pinching at the front right here, okay? When people do come in, they end up with this kind of lean forward posture, and that's giving that pinching sensation, okay? So these are 3 tests that we use in the clinic to figure out exactly if this is the issue that you're having with your shoulder, okay? So the first one would be a Hawkins test. So usually I will simulate the physio right here. I'll place my arm on your shoulder, okay? And then we'd place your arm on top just like this at 90 degrees. I would then push down just like that. And if you are getting pain, it is a sign that you are getting some impingement. So from a side view, this is the practitioner's arm, or you can use a pole. You're just gonna rest your arm on top just like this, okay? And then using your hand on top, you're gonna push down just like that. And it's positive if this triggers the symptoms that you're getting in your shoulder, okay? That's the first test. The second test we do is called the painful arc. So all you're gonna do is you're gonna raise your arm out to the side, and a painful arc is usually about this position here to this position. You'll start to get the pinching sensation through there, okay? So what we can do to test if it's positive is, as you decrease your arm here, if you're getting symptoms, what you can do is you can resist it. So pushing up against here and pushing down. If by resisting on the way down, you get pain relief, it does mean it could be a sign of impingement, okay? The last test that we can do is called the empty can test. So starting in this position right here, thumbs up, all you're gonna do is you're gonna push up against yourself, okay? And then the test is empty can. So all you do is pour out a can like this, so thumbs down, and again, you're gonna push up. So if this does give you pain, it could be a sign that you are getting some sort of impingement. So how do you fix this? There are 2 main things you can do, okay? So this is usually due to tightness at the front. So if your chest and your shoulders get tight at the front, you'll pull your shoulder forward, okay? And it can be due to weakness in the back. So we've gone through some shoulder stability exercises already on this channel, so you can look up for these videos over here. The main thing we're gonna work on today is releasing the front. So the pec minor, which is a small muscle under the chest here, if that does get tight, it can start to pull the shoulder forward. So it can work on releasing that, okay? So what I tend to recommend to my patients is in the shower with a loofah or a bit of, shower gel. You're gonna start just in this fleshy part here. So if you stick your fingers just into the chest, just here, so just right there, it should be very uncomfortable, okay? And all you're gonna do is use your knuckles and you're gonna glide up towards the shoulder, just like that, okay? This will be very uncomfortable when you start, okay? But if you can do it for about 3 or 4 minutes, you'll find that the shoulder pain will decrease quite dramatically.